You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia, and this is the place where I like to share my years of expertise to help you have a healthy mouth for a healthy life, exposing the problems with dental materials, dental treatments, and all the hidden things that go on in your mouth that can impact on your overall health and well-being. So if you'd like to know more, you can hop on over to holisticdentistry.au. But for now, let's get in the zone. I've been talking on recent episodes about mercury-free dentistry, and I'm going to be sharing more about mercury detoxification and why that is important, whether you still have amalgam fillings which contain mercury or whether you've had those amalgam fillings safely replaced. Because we are exposed to mercury every day from environmental food sources, air and water. But if you've got silver fillings in your teeth, yes, those metal ones that look black, they are made up of 50% or more mercury, and the mercury from those fillings leaches out as vapor into your body, where it causes toxicity and harm to your cells, your DNA, your energy centers, your immune system, and pretty much every part of your body. So in the previous episode, I talked about whether it was worthwhile doing mercury or heavy metal detoxification while you still had amalgam. So you may not be able to afford to have your amalgam fillings replaced just yet. You may be doing them slowly, one by one, or you can't access a safe, holistic dentist who will remove your fillings without exposing you to more mercury. Today, I'm going to share about a simple protocol that you can do for maybe 4-6 weeks. And during that time, you study yourself as a case study to see whether these things are making a difference. Now, the medical disclaimer is here. I'm not a medical doctor. This is not medical advice. It is basic information for you to take on board. And I would recommend that anyone who's doing a detox, changing their diet or supplements, has a chat with their physician, their GP, or their healthcare provider first to get guidance. So let's get into it. Let's get into the regime that you can do over the next 4, 5, 6 weeks to see if this supports you to make changes in your health and well-being. And you might be sitting here going, well, Rachel, I already feel quite well. Well, let's just see, because often people don't realize that what has become their norm is not their optimum. And by taking supplements and making some simple little tweaks and changes, you can really get the most out of life and ensure your health and wellness and longevity from now and into the future. So let's have a look at this 4-week protocol and where does it start. I'm going to try and go through the protocol and give you the science so you understand why I'm recommending the supplements that I am, as well as giving you the quantities. And then at the end, I will summarize it to make it more simple for you to follow. Now, there's going to be a lot of big words. There's going to be a lot of scientific terms, biochemical terms. Some of them I may not pronounce correctly or I may stumble over, so I apologize in advance. It's not my strong point, and I am reading from my notes, so I want to make sure I get this accurate for you. But let's go into this, and I'm going to apply the science, and we're going to get to understand why we're recommending what it does and how it's designed to support you with the particular focus on mercury detoxification. So when mercury goes into your body, it's going to bind to sulfur and also be attracted to areas of high fat. So your mercury is going to attach to the sulfur amino acid building blocks in your proteins. And these sulfur amino acids are methionine, homocysteine, cysteine and taurine. There is also a sulfur-containing tripeptide, and a tripeptide just means having 3 amino acids, and this is called glutathione. And this is composed of glutamic acid, cysteine, and glycine. And sulfur is present in all the proteins in your body and the proteins that we eat. Now, numerous enzymes in our body require intact sulfur groups, and many are inactivated by mercury. Cysteine readily reacts with many substances, and studies have shown that there can be some problems if you supplement with cysteine. Animal studies showed that cysteine at high doses can actually increase the transport of mercury into your brain. Now, based on these studies, it would appear that high doses, 500 milligrams 3 times a day of cysteine or N-acetylcysteine, NAC, may cause an adverse redistribution of mercury from the tissues and organs into the brain of anyone that has an existing high body burden of mercury. So although there's no real research studies to indicate that the same happens when you've got mercury vapor coming from your amalgam fillings, it's recommended that if you're going to supplement with cysteine or NAC, you don't exceed 600 milligrams per day. I think further studies are going to be needed until we get kind of that exact figure and whether it's actually worthwhile or not. I'm going to suggest that you use methionine or glutathione as your primary sulfur sources. Articles show that adding high-quality whey protein powder to your diet is going to provide a good source of cysteine. It's going to help support the intracellular production of your glutathione. Now, I'm not a big fan of whey. I don't advocate dairy, but if that's something you want to take and you can take, then I'm not going to say no. You can also look at other sources of proteins like pea protein, which is dairy-free. Proteins also provide an adequate supply of leucine, and that minimizes the transport of metals into your central nervous system. Your body can produce cysteine from methionine or MSM, and glutathione provides cysteine in a form that is less reactive. There is an important caution, though, when it comes to glutathione. If you are low in insulin, if you're insulin deficient, so therefore called diabetic, you should not take glutathione, as it may increase the insulin deficiency because it binds to the sulfur molecules in the insulin and it reduces its availability even further. Therefore, you would say maybe you've got to be careful about taking NAC, which also increases the amount of glutathione levels. So let's look at the regime in a little bit more detail. Now we understand why we need to have protein, because you need the sulfur to help bind mercury and to be able to draw it out from the body. But let's have a look at this more closely now. Glutathione, or GSH. The reason we start with glutathione is that when there's any type of detoxification activity going on in the body, there's usually going to be a tissue redistribution of heavy metals. And what we want is we don't want it to redistribute and go out through the body. We want it to be excreted. So if you get this redistribution, that can result in additional mercury being taken up in the brain, which could aggravate or cause mercury toxicity symptoms. If you've actually been experiencing toxic effects of mercury, then your available supply of glutathione is going to be already reduced. And I read recently that glutathione protects against mercury toxicity. At the age of 2 to 4 weeks, the body becomes capable of excreting mercury through the bile. This correlates with the increasing ability of the liver to secrete glutathione. It is no accident that glutathione deficiency resulting from genetic errors mimics the acute mercury toxicity effects. Without adequate glutathione, mercury from the environment cannot be detoxified and eliminated. You've got to say that then this would apply if you've got a mercury body burden coming from dental amalgam fillings. And you've got to see that you've got to have an adequate supply of glutathione to be able to detoxify the additional chemical insult being caused by the release of mercury from amalgam. I'm going to emphasize how damaging mercury is. A single atom of mercury can bind to and cause the irreversible excretion of up to 2 glutathione tripeptide. Mercury removes glutathione from the cell, and it also inhibits the activities of 2 key enzymes that are involved in glutathione metabolism, the enzyme that your body needs to convert the proteins into this glutathione tripeptase. The glutathione will also help modulate the concentration of mercury toxicity in the cells of your spinal column, your central nervous system. And what happened is they did a study where they looked at the relative toxicity for 5 metal chlorides. So you've got mercury, cadmium, cobalt, zinc, and gold. Depletion of intracellular glutathione resulted in increased sensitivity of the cells to gold by 40-fold, cadmium 8-fold, and mercury 3-fold. And this study further emphasised the devastating effects that dental mercury can have on the body. So the first nutrient you should supplement with is glutathione. This is going to help replenish your supply and should also minimise any effects related to the redistribution of mercury throughout the body. It usually comes in a 50 milligram tablet or capsule, and you should start taking 50 milligrams 3 times a day on an empty stomach. Suggests that amino acids are best taken on an empty stomach so that you avoid them competing with those contained within your food. So you can take your glutathione in between meals, before going to bed, and upon waking in the morning. Take glutathione only for the first 3 to 4 days and don't take anything else. Wait 3 to 4 days before you add the next supplement. An added benefit of glutathione is that it's going to spare the methionine in your body from being used up for detoxification. So you're going to get a kind of dual activity there. Now, the next supplement to add after doing your 3 to 4 days of glutathione alone is vitamin 6 pyridoxine. So 3 to 4 days after starting your glutathione or NAC, you can add your vitamin B6. Now, B6 is critically involved in the metabolism of sulfur amino acids, and this is especially true in the conversion of one amino acid to another. B6 is needed in the metabolic processes that convert methionine to cysteine to glutathione. You've got to have an adequate intake of vitamin B6 to ensure that your body has the needed nutrients to produce cysteine and convert it to additional glutathione. The recommendation is that you take 50 milligrams of B6 tablet per day with your breakfast. B6 can cause reversible disturbances to your peripheral nervous system if you take it in too high a dose. So make sure you're not overdoing it. So sometimes with supplements or nutritional things, less is more, or the right amount is perfect. There's another important reason to ensure that your vitamin B6 intake is adequate. It's one of the nutrients involved in the transsulfuration pathway that is essential in the metabolism of methionine. Homocysteine is another remethylated to methionine or metabolized to cysteine by the transfloration pathway. So this biochemical conversion of homocysteine to cysteine is actually dependent on 2 consecutive reactions that are dependent on vitamin B6. And without that, it doesn't happen. Now, your vitamin-derived cofactors are essential. Your pyridoxine, your B6 for transsulfuration, and folic acid and vitamin B12 in the methionine cycle. Vitamin B6 and folic acid and B12 are necessary for the next transsulfuration step that converts homocysteine to cysteine and glutathione. So if you're vegetarian or vegan, for example, you can often be low in your B vitamins, and therefore it would be important to take a multi-B complex that you're going to get your B6, your folic acid, your B12, and you'll see as we go through this regime also your B1. So current research is identifying that high levels of homocysteine, which you would then convert into cysteine and glutathione with adequate B12, folate and B6. If you've got high levels of homocysteine, it's a serious cardiovascular risk factor. So if you look at this and we go beyond detoxification, mercury has a great affinity for thiols, and this could be a factor in the reason why somebody ends up with issues because of lack of transsulfuration, which would lead to the raised levels of homocysteine and subsequent cardiac problems. Because of this, the more methionine you take, the more B6 you require. And you should also ensure, as I've said, that your intake of folic acid and B12 is adequate to make sure you're converting the homocysteine. So the next supplement that you would add 3 to 4 days after you start your glutathione and your vitamin B6 is vitamin B1 thiamine. This is taken as a 50 microgram tablet, and you take 1 tablet with each meal for a total of 150 micrograms per day. B vitamins are involved in energy metabolism, supporting the systems which protect your body against free radicals. The central nervous system is especially vulnerable to B1 deficiency. Vitamin B1 also contains a sulfur group and has been used to treat mercury poisoning via intramuscular injections. The vitamin has a rapid turnover in the brain, and the levels are reduced by mercury exposure because mercury oxidizes thiamine, which is your vitamin B1, to thiochrome. Studies have found that thiamine works more effectively against mercury than even things like selenium, which is actually really good at mopping up mercury. Thiamine enzyme, thiamine pyrophosphokinases, and the sulfur groups participate in the stabilization of the molecular structure of the enzyme, and mercury can inactivate that enzyme. The symptoms of B1 deficiency and mercury poisoning are almost identical. And now I'm going to move on to talk about silymarin. Silymarin, or milk thistle, is a herb that offers powerful protection against liver toxins and assists to detoxify the liver. Silymarin activity in the liver includes antioxidant protection against free radicals and has also been shown to assist in the generation of new liver cells. It has also been shown that milk thistle and its principal components protect red blood cell membranes against lipid peroxidation and hemolysis, which is the breaking down of the red blood cells that is induced by certain red blood cell poisonings. And lipid peroxidation is basically fats going rancid. This condition is also referred to as glucose 6-phosphate dehydrogenase deficiency, or GSPD deficiency, and reduction of available glutathione as well as G6PD inhibition can be caused by mercury. In the liver, one of the functions of glutathione is the conversion of fat-soluble toxins into water-soluble toxins so that they can be eventually excreted via the urine. The importance of this is that heavy metals and many other toxins are actually fat-soluble. Mercury will go to areas that are high in fat and high in sulfur. And excretion through bile is the only way that fat-soluble compounds can be effectively eliminated from the liver. Now, the bile is what gets produced in your gallbladder. However, most fat-soluble compounds end up being reabsorbed after they get excreted from the liver. So when you combine that with a toxin substance, glutathione breaks this cycle. It permits the elimination of water-soluble toxins through the kidneys as well as the feces, provided that your gut microbiome, your gut microflora is actually functioning properly. If the microflora contains large numbers of mercury-resistant bacteria, which does occur from inhalation and ingestion of mercury from dental amalgam, the excreted mercury will again be transformed and re-enter the enterohepatic cycle. So basically it goes back into your body. Now, this means that the importance of acidophilus can't be underestimated, and the elimination of the source of mercury contamination is required in restoring the bacterial symbiotic balance in the intestine. So in other words, to be able to detox, you've got to get rid of the source of mercury, and then you've got to rebalance the gut bacteria before you can really start your detox program. Another reason why Silmarian appears to be effective is that it can increase glutathione levels in the liver by as much as 35%. Now, the symptoms of an overloaded liver include fatigue, headache, muscle pains, digestive disturbances, and constipations. Other symptoms may include anemia, pallor, which is looking pale and pasty, dizziness, and poor coordination. Most of these symptoms are also associated with mercury intoxication. So let's put some milk thistle, some silymarin into your self-test regime. Now, this is available in a tablet, capsule, or powder form. Start with a single 100 milligram capsule taken with a meal for 2 or 3 days, and then increase that until you're taking the 100 milligrams 3 times a day. Now, you might not be able to find a 100 milligram size. It might be a 50 or a 200. Then just use the product that's going to be closest to your 100. So if you've got a 50 milligram, double up your dose. So you want to start single dose, 100 milligram capsule or tablet with a meal for 2 or 3 days, and then increase that until you're doing 100 milligram 3 times a day. Now, zinc is the next nutrient that you need to add, and zinc stimulates the productions of metallothionein in the body, which is one way the body detoxifies mercury. Metallothionein is very rich in cysteine. Animal studies have demonstrated that zinc can help promote against the toxicity and damage caused by mercury. Zinc can help prevent mercury-induced testicular damage. If you don't have adequate zinc, which is depleted by mercury, you can't produce your sperm properly either, guys, and it can produce infertility. Someone who has a chronic source of mercury exposure, such as that from dental amalgams, should ensure that their zinc status is properly maintained. Mercury uses up zinc stores in the body, and this can result in zinc deficiencies unless you've got adequate supplementation. There's several different kinds of zinc available, all with different potencies. It's suggested that you take 1 zinc tablet per day with a meal, and that can be a 15 to 30 milligram tablet. After you've been taking your glutathione and your vitamin B6 for 3 to 4 days, then you can add 1 zinc tablet per day to your regime and continue the 3 items for an additional 3 to 4 days and closely observe yourself for any changes. Now, just a note on zinc. Do not take zinc on an empty stomach. It will cause nausea, it can cause a little bit of tummy cramping, and it can also make you instantaneously vomit. I don't know the science behind it off the top of my head, but from my own experience and that of clients and even staff members taking zinc, where they just go, oh, I forgot to take my zinc, I'm just going to pop one. Yeah, it does cause a bit of distress, and we don't want you throwing everything back up and making yourself feel worse. So we start with glutathione, we add our B6, we add in our zinc, we can take some milk thistle, and then the next thing we're going to add is vitamin C. Now, there's some studies that would say vitamin C binds to mercury and it reduces your overall body burden. And then there's some studies that says that it doesn't. But studies do indicate that mercury will bind to the oxidized derivatives of ascorbic acid, and then it helps to increase the excretion of mercury and reduce the overall body burden. One of the good reasons for adding vitamin C to your detox regime is because it's going to reduce free radicals that are produced by the normal metabolic processes and those that are produced by the actions of heavy metals. Prolonged exposures to low-level mercury concentrations tend to depress the adrenal ascorbic content. So providing additional vitamin C would help restore or maintain these adequate adrenal levels of this critical nutrient. So you've got to offset the depletion of the chemical stress caused by chronic inhalation of mercury vapor. There are many forms of vitamin C, from plain ascorbic acid to those buffered with calcium or magnesium. Now, I prefer the buffered ones or ascorbates, because they're not going to be acidic, they're not going to put more strain on your body. I find that they're more readily bioavailable, which means you actually absorb them better. So whatever one you start out with, start with 500 milligrams per day, taken with a meal, and then after 3 to 4 days, start increasing your dosage until you're taking 1,500 milligrams per day. So maybe you put that as 1.5 grams, and you do that in divided doses. So have 500 in the morning, 500 at lunchtime, 500 in the evening. And then that way you're spreading out the dosage, which reduces any stress or de-stress on your gut, because too much vitamin C for some people can cause diarrhea. But you're also drip feeding a nice steady supply so that the vitamin C is available throughout the day. I will also recommend doubling this dose up to 3 grams a day, particularly if you've got lots of inflammation, signs of gum disease, bleeding gums, because you could also be vitamin C deficient, and that's causing some of your gum disease issues. Then the last thing that we add is selenium. Selenium is essential. That means it's necessary for life. It's a trace element, and it closely resembles sulfur in its physical and chemical properties. You don't need a lot of it. It's got really good antioxidant. Let me just reword that. It's a component of one of the antioxidant enzymes in the body called glutathione peroxidase, and this enzyme neutralizes hydrogen peroxide and oxidized lipids, which are fats that have gone rancid. Selenium is also a really crucial component of the enzyme which produces your thyroid hormone T3, and that's the active form of thyroid hormone. And a lot of people with underactive thyroid can't convert everything that they need into T3, and you will see this very commonly with people who've got amalgams and are mercury toxic, because mercury inhibits the formation of T3. It's also mopping up all your selenium, because your selenium's binding to mercury, and it causes a redistribution of tissue mercury. It precipitates some excretion of mercury from the body. So you need to have your selenium. But some amalgam poison patients have difficulties in tolerating even minor doses of selenium and can react with increased symptoms such as digestive problems, nausea and vertigo, etc. If you suspect that selenium increases your symptoms, you can just opt not to take it. You can take it in a microdose, just like 1 drop. If you get the liquid form, that's a really good way. Or you can just use vitamin E instead to counteract the mercury-induced lipid peroxidation. Selenium is available in several forms and potencies. The inorganic selenium is the substance which has been used to protect experimental animals from mercury poisoning. If you take inorganic selenium, you will not risk slow buildup of tissue selenium because the excess will be excreted in the urine. Organic selenium, on the other hand, that gets incorporated into proteins instead of the sulfur-containing methionine. So it can build up over time, and you don't really want to have too much selenium. So go for your inorganic and really stick to the dosage. It's suggested that you start with a 50 microgram tablet 3 times a day, so you're taking a total of 150 micrograms. Now, pay attention. Please note, selenium should not be taken with your vitamin C, not at the same time. So take your selenium between meals or whenever possible, about 2 hours either side of your vitamin C dose. So either 2 hours before or 2 hours after. Because vitamin C reduces or binds selenium to produce selenite, which is biologically unavailable, which means you can't use it. So just make sure that you're doing your 50 micrograms per day and make sure you're not having any adverse reactions to it before you start doing any increase. You can take methyl sulfonyl methane, which MSM for short, you can see why it's hard to say, or dimethyl sulfone, DMSO2. These are a major metabolite of dimethyl sulfoxide and is marketed as a natural dietary sulfur compound which provides bioavailable sulfur. MSM is a good source of sulfur, but now it may cross the blood-brain barrier and therefore it may have the possibility of it complexing with mercury and carrying more mercury into the brain. So I would not necessarily go along the MSM path anymore. We used to recommend it quite a lot. I just mention it here because you may find that some regimes that you read about recommend it. And I'm saying it's not really necessary if you're doing the other thing. Now, another thing you can take is N-acetyl L-cysteine, NAC, which forms L-cysteine, cysteine, L-methionine, glutathione, and mixed disulfides. This compound has the ability of being able to stimulate your own body to produce large amounts of cysteine and glutathione. It greatly augments the plasma and red blood cell content of both cysteine and glutathione. Where animals were exposed to mercury in experiments, particularly mercury vapor, NAC treatment increased their survival time and decreased mercury levels in the blood, lung and kidneys. NAC is very effective in increasing the excretion of methyl mercury. So you may want to try NAC to increase your body's ability to produce additional cysteine and glutathione. You want to start with a smallest dose possible and then build that up gradually. As with other nutrients, you should start your NAC 3 or 4 days after starting your glutathione to ensure you do not have any type of reaction. And again, don't dose more than 500 to 600 milligrams per day, and the use of NAC is optional. Now, some people may have beneficial health effects from this regime, and from taking the indicated supplementation. And this may happen within the first week. I've seen that with my own patients. We start supplementing them, we get them in to start their amalgam removal, and they're telling me that they're feeling much better already, and that's fantastic. But in others, it may take 2 months, 3 months for you to notice any improvement, and there's also a chance that you won't experience any benefit whatsoever. However, it's a non-invasive, cost-effective way to do a little bit of health detective work to see if these things do have any change on your health and well-being. Now, if you do get improvements in your sense of well-being, your energy levels, and a relief or reduction of existing symptoms, these are all positive indications that your glutathione levels, your peroxidine, your zinc, your vitamin C, your thione, and selenium had actually been impaired, that you hadn't got what you needed in your body. But it doesn't categorically mean that something like mercury or other heavy metals were the cause of that. But it does indicate that there's a serious consideration to be given to that is an actual possibility. Well, okay, we seem to get through the big words pretty well. I hope you've followed along so far and that you've got some benefit out of listening to the science behind these supplements, because I think if you just get told take these supplements and you don't really understand why or what they're doing, it kind of doesn't add as much benefit, and it also gives you an idea of what's on in your body and why mercury is making you feel the way you are. So let's just summarize it to make it easy for you. You're going to start with glutathione, 50 milligrams 3 times a day with food. So you're taking 150 milligrams a day. Then after 3 to 4 days of taking that, you add in the following: your vitamin B6. So you have a 50 milligram tablet with breakfast, and you need to make sure that you've got enough folic acid and vitamin B12 as well. Your vitamin B1. So you're going to be taking 50 milligrams with meals 3 times a day for a dose of 150 milligrams in total. Your milk thistle, starting with 100 milligrams for 2 to 3 days, and then build that up so that you're taking your 100 milligrams 3 times a day. Then zinc, 15 to 30 milligrams with food, not on an empty stomach. Then add in vitamin C, 1.5 to 3 grams a day in 500 milligram doses. So you can take 3 doses, breakfast, lunch, dinner, or you can take 6 doses, however you want to do that. You're also going to take selenium, 50 milligrams 3 times a day, not with your vitamin C, so 2 hours before or 2 hours after from taking your vitamin C so that it doesn't bind and inactivate it. And an optional one is you can add your NAC, but no more than 500 to 600 micrograms a day. So that's the supplements that would be recommended. I also ask my patients to take krill oil just so they're getting a few more antioxidants and vitamin E as well, because that helps with the free radical buildup and that fat oxidation that I talked about. So what I'm asking you to do, if it's something you'd like to try, and very beneficial, I would suggest if you still have amalgams, to help reduce that body burden and offset some of the damaging and toxic effects, is to try this regime from 4 weeks up to 6 weeks. See how you feel. Make a little diary and document what's going on for you. And if you do see improvements, then that's going to show you that you were either very depleted in those minerals and vitamins and proteins in the first place, and that was affecting your body. And it is potentially saying, therefore, this has happened because, to some extent, of the mercury contamination within your system. None of these things are going to be harmful to you. They're all things that your body needs for its metabolic pathways and for its detoxification processes. The other thing I'm going to stress and say, hey guys, please make sure you're doing this. You've got to drink plenty of water, because your glutathione is going to convert those toxins into water-soluble toxins, which then can be excreted through your urine and your feces. Another thing you can add in is the acidophilus, or a good probiotic to help improve your microbiome, to help improve your gut flora, so that your digestion is working more competently, so that you can process and digest and eliminate and excrete the toxins. I'm Dr. Rachel Hall. This is the Dental Zone podcast. Thank you so much for joining me. This has been your dental mercury detox regime and the science-based heavy metal detox program. Now, again, the medical disclaimer: you must seek guidance from your doctor, physician, or healthcare provider before starting on any detox program. You need to make sure that you're good to go, and you need to make sure you're getting support. I'm not your physician. I am giving you some general advice based on scientific research and my understanding of mercury toxicity and what impacts it has on your body and the bioavailability of your proteins, nutrients, and trace minerals. Thank you so much for listening. If you want to know more, then hop on over to holisticdentistry.au, and you can listen to all the other podcasts there as well, or on Apple Podcasts. Until next time, I'm going to say stay in the zone, but if you are in the Brisbane area, or you're willing to travel to Brisbane, as a lot of my patients do, from interstate and even overseas, if you want to get your amalgams removed safely, then you can give my clinic, Evolve Dental, a call on 0737 201811. We'll book you in for your comprehensive amalgam removal consultation, and we'll come up with a plan going forward so you can safely remove those mercury-containing amalgams and get yourself back on the road to health and wellness, or prevent problems down the track. Until next time, thank you so much. Stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.